Hello, Sally. Hello, Kirsty. Welcome to
Hi.
our first ever little online Zoom recording. Talking to the lovely Sally tonight, sort of try and understand a little bit more about her cancer story. I'm Joe, events lead at Bloomhill Cancer Care. We have Kirsty, one of our lead nurses at Bloomhill Cancer Care, and the lovely Sally Kriel. And I'll let Sally introduce herself in a second, and we'll jump into some questions. Hey, Sally.
Hey, thanks so much, Joe and Kirsty, for having me online. I'm really excited to talk to your clients there at Bloomhill and to share, I guess, a little bit about my story as a nurse who became a bowel cancer patient and who is still a bowel cancer patient, and just really hope that this resonates with some people who will be listening tonight. So please feel free to reach out and ask me any questions, and I have my contact details there at the end. So my name is Sally Kriel. I am a clinical nurse consultant, author, and do some work in the advocacy space as well. Before we get started, I'm just going to move my slides along here. Okay. Here we go. I really like this quote. It is a quote that resonates with me, and it will resonate with so many people who are online and who watch this recording in the future. And it's nothing is predestined. The obstacles of your past can become the gateways that lead to new beginnings, by Ralph Blum. And this is a quote that I have embraced, I guess, from the time of my cancer diagnosis. And it's something that I live and breathe, I guess, now today. And I think throughout this presentation, you'll see a little bit of why. So at the age of 38, I had just returned from my second maternity leave, and I had an 18-month-old and a 3-year-old, and I had been experiencing a little bit of abdominal pain and discomfort, some cramping, and I went to see my GP after about a month of pain and described my symptoms. And she said to me, Sally, look, I think we should do a colonoscopy and we should do an ultrasound and some blood tests. So I held on to my referral, and about 6 weeks later, I went to have my scope. And it was at that time, it was on a Friday, and on a Monday, I was called back to the GP office. I had my 2 little boys with me at the time. And as soon as I received the phone call and heard my GP's voice, I knew that I had cancer. And
Scary. See you then.
yeah, it's I think all of us who have been given a cancer diagnosis will remember that moment. It is, I describe it as a visceral feeling. I can feel it in my body still now, talking about it. And it's something that you can recall the words. You can often recall being in obviously complete shock and disbelief in your response. So it's something that will stay with me, of course, for the rest of my life, and for most of our clients as well at Bloomhill. But in that moment, sort of sitting in the GP office, my 2 little boys by my side, I felt like I was in a slow-moving car crash. I felt that I was out of control. I was not sure what the next steps were, and I really was not sure when this nightmare was going to end. And again, a lot of people will be able to resonate with that feeling. And I guess what I didn't realize, though, is that whilst my cancer diagnosis was a huge challenge, being told that I was too young to have bowel cancer at the age of 38 was actually probably a bigger challenge for me. And our younger bowel cancer patients may have experienced this, where they're told that bowel cancer is an old man's disease. We don't see it in younger adults. You're far too young. I've never heard of a younger person being diagnosed at your age. So that is quite a challenge, because I felt like I was too young to have the condition that I had in fact been diagnosed with. But as we now know, bowel cancer is diagnosed in over 10% of people who have sorry, 10%, over 10% of people who've been diagnosed with bowel cancer are under the age of 50. And we know that that number is actually on the rise. So
Wow.
I was told that I was too young to have bowel cancer on my admission to hospital. The nurse who was preparing me for theatre, as she was sort of putting on my ECG, she said to me, gosh, Sally, you were so young. We don't see many patients like you. The anaesthetist, when he came in to consult before my surgery, said to me, most patients who I see of your age who are having this operation, they have Crohn's or sort of colitis, a different type of bowel condition. Of course, I'm a nurse, so lots of clinical colleagues said to me, Sally, you're very young, well-meaning friends and family, of course, colonoscopy clinic. So every scope that I go and have, I will always have a person say to me, gosh, you're very young to have bowel cancer. And the media. So over the years since my diagnosis, I've been interviewed many times on my condition and my path, my advocacy work now, and it is a common misconception. So I guess learning or having to navigate a condition that you were too young to have, or society is telling you that you were too young to have, is very, very difficult. And a lot of those challenges for me come from balancing a recovery with parenting of younger children. So we're told, rest, you need to heal, focus on you. But when you have an 18-month-old and a three-year-old, how exactly do you do that? Of course, and Kirsty would know a lot about this, the funding and support services for adults under the age of 65 is just not there. We don't have a lot of funding. And in particular, respite, which I'll come to in a couple of slides as well. And of course, because we don't have a national funding program for our bowel care nurses in the same way that we do have for our other common cancers, such as breast and lung, prostate, of course, lymphoma, ovarian. We don't have often services that are well coordinated and accessible. And many of us, because we are working adults, we experience a loss of income. So for me, the unique challenges, I guess, that I faced as a bowel cancer patient were related to body image and self-esteem issues, loss of confidence, bowel dysfunction, and fatigue, relationship and carer strain. Of course, my husband still had to work. He was finishing off a PhD. We didn't have a lot of support around us. So it was a very, very challenging time. Grief, and I talk a lot about this, so the loss of a worry-free life. So and again, a lot of people will be able to relate to this when you have been diagnosed with an illness, you know, that the worry-free life that you once had, and you don't have to think about your health and your mortality, that in an instant is gone, and that's quite a challenge. We have, of course, a lot of friendship changes, and this is probably one of the biggest challenges that people will talk to me about. So lots of people find that friendships will slip away, and that is really normal. Sometimes, of course, we gain new friendships, and I certainly do, which was fantastic. Returning to work at the 12-month mark. So I had a good year off work, which I was very fortunate to be able to do. But we find that when we get to that 12-month mark and we're feeling well enough to sort of return to a somewhat new normal life, that's often the time when we stop our fight and flight response, and then we move into what on earth just happened, and all of our support has fallen away. So we don't often have, you know, for example, regular medical appointments. We're not seeing our specialists as often. And it's quite a challenging time, because we're expected to go out and get back to work. or to resume our normal life, whatever that is, but then our safety net is gone. We also have a new perspective, which is both a blessing and a challenge. So when I say I don't sweat the small stuff anymore, I see life quite differently, and that has been a huge advantage. But that means that I also have less time for minor issues, and that doesn't always resonate with people. So sometimes your new perspective will actually lead to change in friendship circles. It will also potentially lead to changes in work, new perspectives, and I guess forging a new path. The regular reframe on what is important, that has been, I guess, something that I have done throughout the last few years since my cancer diagnosis. But the challenge here is that takes work, because just because you've had a cancer diagnosis, it doesn't mean that you're not going to forget and fall back into those old habits. So that's definitely an ongoing challenge. So I talk about, I guess, my dark night of the soul, which happened 6 months into my recovery, and I was trying to find some respite. And I was also trying to organise some additional daycare support for my boys. So I was able to organise some additional funding for daycare. And fortunately, since I've been diagnosed, we've had a lot of changes and new funding come through. So parents are now able to access support more easily. So with a carefully worded GP letter, I did manage to get that extra support in place. But the respite I could not get. And after phoning 3 different organisations and being on the phone for 3 hours, I was told by many different respite groups, "I'm sorry, Sally, we hear your story all the time. We just do not have any funding and support available to you for respite." So I decided, well, if I, as a nurse who has 18 years of experience, a lot of ability to advocate for myself and ask for help, am struggling so much, I wondered, what on earth is everyone else doing? So I decided to start taking notes, and those notes became hints and tips and different, I guess, sources of advice, which became blogs, which became chapters of a book. And I'm really fortunate now that my book is given to women at the hospital where I work at the time of the diagnosis. And Kirsty as well also has some books there at Bloomhill, which is great. And I guess the goal there is for patients to be given the book at the time of diagnosis, so not sort of months and years later. And I guess a little bit about how my life has changed now. It's been 5 years or almost since my diagnosis, and I've been advocating for equal access to care for Australia's bowel cancer patients and their loved ones. So that is all about the national funding for bowel cancer nurses, which I talk a lot about. We now have the movement through Bowel Cancer Australia, which is an incredible online support group. And that is available to any bowel cancer patients and their loved ones to join. We have an online forum. We have monthly expert recordings, and we also have monthly face-to-face catch-ups online. And I guess I just wanted to end just some top tips from me. And these are, I guess, some things that I wish that I knew early on in my diagnosis and embraced a little bit more. So really, really important is to delegate, defer, or delete. It's okay to be selfish. And this really is a time in your life where it is okay to say no. And it's absolutely okay to say yes for help as well. Your health is your number one priority. So that means your recovery is your number one. So calling in your Bloomhill A team is incredibly, it's essential. So that whole allied health team, from your nurse to your exercise physiologist to your dietitian to your medical specialist. They are all there and play a critical role in helping you to get better. So please do lean on them, talk to them about any symptoms that you are having, any challenges that you have, and ask for help. One mistake that I definitely made was about, I guess, accepting that a lot of my symptoms were just what I had to put up with. So it was only when I reached out to the bowel care nurses and said, I'm struggling with these things, is this just my life now? That I realized that, in fact, I'd been putting up with symptoms for a really long time that I didn't need to. But I thought that I was just going to be complaining, and I should just be grateful that I was alive. So that's a really important message. Really basics, so the basics of health, the pillars as we all need, but we sometimes forget. But your nutrition, your exercise, good quality sleep, and of course laughter are your pillars of health. So finding ways to optimize those is really important. How you feel about your cancer today is not how you will feel in 12 months' time. And even now, every year, I get a new perspective and see my cancer diagnosis and my life through a different lens. And I guess what's important there is, on your really hard days, to tell yourself that tomorrow is going to be a new day. And then in the future, things are going to change. So trying to keep a bit of space and perspective is really important. Dr. Google, all patients love a good Dr. Google, so do carers and loved ones, and do use it, and you can't not Dr. Google, but just take what you need from it and balance it, of course, and confirm it with the experts in your healthcare team. So we do find that a lot of patients do find, for example, new clinical trials, or they find advice from other bowel cancer patients, for example, through forums like the Bowel Cancer Australia group, which is really helpful. But sometimes there is information on there, of course, which isn't correct. So check in with your healthcare team. Ask lots of questions. I often, again, chat to patients and they say, oh, I wish I would have asked. I didn't feel confident to ask that question. Is that okay if I ask for a second opinion? Or is it okay that I ask if this is the right treatment for me? And the answer is absolutely yes. If you, again, going back to that, your health is your greatest priority right now. So finding your power and knowing that it's absolutely okay is essential. And asking, plenty of questions, have days off from cancer. So I used to make myself have days where I wasn't allowed to think about cancer. And of course I did anyway, but I would tell myself that was enough after a couple of minutes, because it does become all consuming. And we've never been busier before we become, and until we become a cancer patient. I thought pregnancy and having little children was busy, but becoming a cancer patient was something else. And I guess just finally, there's no better time than now to reflect on what makes you happy and what you want to do with your, I guess, with your time. So use your reflection time to your advantage. And that's something that I think about every day. What is making me happy? And I do ask myself, is this making me happy? So a new perspective is absolutely an advantage.
That was really great.
And
Sorry.
that's it. So that's where I am. If you want to find me and get in touch.
That's excellent. Thank you so much for sharing that. In particular, as a cancer survivor myself, I noticed some of your tips there at the end, which I 100% agree with, and I know exactly where you're coming from in suggesting those. I'm going to come back to you in a second. I just want to flick across to Kirsty. And Kirsty, was there anything that sort of highlighted there out of Sally's story that maybe you want to touch on that might help clients going through something similar in the future?
Yeah, I think when Sally, you were mentioning about being a younger person with cancer and how I guess you're constantly faced with people telling you you're too young for cancer. I hear that a lot, sadly, and even myself, I've experienced that. I had a colonoscopy last year, and the gastroenterologist said, "Oh, don't worry, we're not worried about cancer. You're too young." And I said, "Well, I'm a bowel care nurse. I spend my day talking to very young people with bowel cancer, so please stop saying that." I think it's said, as an offer of reassurance. I think it's said, as a way of, being empathetic, like, gosh, you're too young. That's not fair. I don't think it's meant with any ill intent or malice, but the message then just, I think it helps spread that misinformation that cancer doesn't help to happen to young people. And we sadly know that that's not true. I would say at least half of my clients coming through at the moment are under the age of 50. And incredibly sad. It's actually very nice to be able to say to people, you're not alone. There are other people here at Bloomhill in our community that are young and living well with cancer. And finding connections and finding somebody with that shared experience, I think, has been really helpful for people coming to Bloomhill who are under the age of 50. When you're going through treatment, I hear a lot of people saying that they're having their chemotherapy and they're the youngest in the room by at least 20 years. And it's hard to connect with somebody who's just not in that age bracket as you are. Like, the impact of cancer in your 40s is going to be so vastly different to the impact of cancer in your 70s. So, as you said, bowel cancer in particular, is on the rise in young people. And it's important to try and find those connections, to find a peer connection through Bowel Cancer Australia or at Bloomhill, so that you're not alone and you can get some really good advice and support from somebody that's your own age.
Yeah, we couldn't agree more. And I think just to be able to meet someone who is a few steps ahead of you is really reassuring. So when I first was diagnosed, and I would look online and try and find different stories of people just like me, I didn't find them other than media sensational stories about young mum dies, or there was nothing that was reassuring that I could find online. And that's why if we can help to talk to patients about the treatment options, and we can help patients to connect at all different stages of cancer, that is really, really powerful.
For sure. Definitely great advice there. We've got a few more minutes left before we have to end this recording, but just, Sally, if I could just ask, getting back to Bloomhill for a second, what were some of the things that really maybe stood out for you that sort of Bloomhill was able to help with at a time that you really needed?
So I still remember phoning Bloomhill, and I was so exhausted that I actually phoned the wrong organisation to begin with. And so because I'd referred myself patients to Bloomhill, I knew that I was meant to be phoning Bloomhill, but I was just in such a state that I phoned the wrong organisation first. And then I worked out, oh no, I need to phone Bloomhill. And then just coming in for my nursing assessment in itself was an incredible supportive experience. And I found that I'd finally found a team of people who understood me and where I was and what I needed. And I still get quite emotional actually thinking about that first encounter. And there was a lovely nurse there who no longer works for the team, but she, within half an hour completely understood my picture. I felt supported. I felt that I had a plan. At the end of our appointment, I was booked in for some counselling and some exercise sessions. And she handed me 2 meals that were frozen and said, here you go. And I just thought, oh my goodness, it was exactly what I needed in that moment. And to find a team of healthcare professionals who understand your needs so well without you actually having to drill down and explain every single element of your story was incredible. The counselling support was again just incredible, because it was support for me but also support for my husband, and we were looked after as a whole person. a whole family unit. So we would have separate sessions. So I would go myself for my own support, and then we would go as a couple for support. So to be able to have an organization who wrapped us up and said, we are here to help you, is, yeah, it's incredibly special. And then the exercise support. So I had a couple of sessions just with, to get a plan in place. And I didn't actually realize at the time, unfortunately, how important exercise was. None of my specialist team had sort of explained, if you exercise this amount of time, this many days a week, you will reduce your cancer recurrence risk by 40%, for example. Your mood will increase, etc., etc. So that is something that we need to focus on as a healthcare team, to make sure that patients are aware, because once I did eventually get into regular exercises again, my life had changed considerably. But I did also need my symptoms managed before I could do that. So it was a bit of a catch-22, and we didn't have Kirsty as part of the team then. So it took me a long time to get to a point where I was able to access a specialist nurse. And thankfully now your team already has that there in place. So, you have the full complement of holistic care there. And acupuncture, which I nearly forgot. I saw the wonderful Alex many times, and she again, you didn't have to say anything other than help me now. She worked her magic every week or so.
A lot of the beautiful stuff we did here at Bloomhill just nicely. Thank you. I'm getting a warning from Zoom, and I've got a couple of minutes left. Is there any questions anyone wants to throw in towards Sally before we finish up? No, I'll make this recording. I'll save this recording and have it available from probably early next week. The nurse's office will have it available. So if anyone wants to listen to a copy of it down the track, we'll have it available, or just contact Bloomhill and get in contact with either Joe, that's me, or the nurses, and we can pass it on. But I'm going to wrap it up before we get cut off by Zoom. But thank you so much, Sally and Kirsty, for joining in. Really appreciate that, and wishing you a great night and the rest of the weekend.
Thank you.
Thank you, girls. Bye.